Hi, I'm Dr. Mark Bell with City of Orange Physical Medicine Group. Welcome to another segment of Your Healing Minute. Today we're going to be talking about heel spurs. What are they? Symptoms, diagnosis, treatment, and prevention. So let's jump right in. Heel spurs are calcium buildup of a ligament or a tendon from repetitive motion trauma. So basically what's happening is that if you played sports, this could be years ago, you were a runner, you were a jumper, walking on concrete our whole lives, which our feet aren't supposed to be doing, wearing poor supportive shoes, causes a chronic inflammatory process on the bottom of the foot. Here in the plantar, this is an x-ray of a foot with a digital x-ray, and the plantar ligament through here of repetitive motion trauma of the foot going down, stretching and tearing of the ligament causes an inflammatory process. It starts with plantar fasciitis, and then if you have that long enough, eventually what happens is that your brain will just tell this area, instead of it keep tearing and healing, it'll just turn it to bone. That's what calcification is, where it's actually turning the tendon ligament into bone. But now it starts another process of now that bone now becomes a spike. So this is a heel spur of a patient that we have. And you can see right here, instead of this being smooth all the way through, there is now, literally this is a bony spike coming off. This is a heel spur. Okay, so this is where the ligament has calcified now and has formed this sharp bony protuberance right here. So every time they step, it's painful. And the symptoms of a heel spur, usually it's more sharp stabbing pain in the morning when you first get out of bed. It may get a little better throughout the day, and then later on in the day it turns into an ache. And I don't have one myself, but I understand it can be quite unbearable. So not only are you going to have foot pain, but because you're probably going to start limping now because of the pain, you're going to start having some knee issues. Knee will start to hurt, same side or opposite side, maybe hip pain, low back pain, because you're changing the way that you walk to compensate from having pain. So that starts a whole nother area of problems. So how the diagnosis is made: X-ray or MRI. This is like I said, this is a digital X-ray. Heel spur is very visible right here. So MRI will show the same thing, but MRIs will show more of the soft tissue. But X-ray is perfectly fine for diagnosing heel spurs. So treatment depends on the size of the heel spur. This heel spur is pretty far along. So I told this patient, anything that you do is only going to be temporary. You can do cortisone injections, which are a treatment, physical therapy, exercises, massage, orthotics, which are arch supports that go in your shoes. They have heel pads you can put in your shoe, and all those are going to be temporary. Eventually, because the size, this one's gotten so big, it's going to have to be surgically removed, usually by an orthopedic surgeon who's trained more so on feet. So yeah, that one's going to have to be removed. If you catch them while they're small enough, a lot of times they can be helped. You can't stop that process, but you can slow it down. But usually, eventually with heel spurs, most people end up having the surgery after a while. So prevention is wearing good shoes, putting in arch supports. If you have a plantar fasciitis now, make sure that you start getting treatment for it and get it taken care of before it becomes a heel spur. We do that here at City of Orange Physical Medicine Group. We scan your feet. We do deep tissue. We can do injections if we need to, if people are farther along with their pain. Weight is a big issue. Obesity, the extra weight is putting extra stress on the ligament as well. Diabetes seems to be a predetermining factor a little bit as well too. So, but a lot of those things we can address here. So if you're in the Orange County area, you'd like to have your feet checked, we have 3D scanning to check the arches, and we have digital X-ray to get a nice sharp view of your feet. All right, so thank you for watching, and we'll see you next time.